More on how hospitals are coping, let's bring in Dr. Stephen Parodi from the Permanente Medical Group in Oakland, California. Thank you very much for joining us. Things have changed a lot since we spoke a couple of months ago for the worse, unfortunately. Just give me a sense of what you're seeing right now in your hospitals.
Good to be with you this morning, Kim. The reality is that we're seeing record numbers of cases in our hospital system. We have more than 800 individuals that are hospitalized within the Kaiser Permanente system in California. We're seeing record numbers of calls into our call center, which really tells me that we're still seeing increased amounts of transmission in the communities. This is putting a stress on the hospital system, on our emergency rooms. The reality is that we are coping. We are better prepared than we were 2 to 3 months ago, so we have more surge capacity. But I remain concerned, just as the emergency physician who you just had speaking, about the ultimate capacity that we have given the increasing spread.
Mm-hmm. I mean, you say you're coping, but you know, as we've heard, you know, doctors are having to make these hard choices. How far are you away from that situation now, from what we're seeing in Texas and Arizona?
So fortunately, California is not having to exercise what we're hearing about in other states, which are crisis standards of care. That being said, I am concerned that if we don't reverse this trend, that we would be facing that same very situation. It is not too late to actually take action at a public health level and at a public policy level. And from my standpoint as a physician, as an infectious disease specialist, it is time to reinstitute a number of those interventions that we had done actually effectively 2 months ago to reduce the spread of this disease. If we don't do that, I am concerned about the capacity of our hospitals and really of our healthcare system from a staffing perspective and from a space perspective.
Infectious disease specialist and as someone who oversees the hospitals, I mean, what specifically is your biggest fear here? The number of hospitalizations that's growing? Is it the positivity rate? What of all the numbers that we're hearing is sort of the most frightening?
You know what, it's kind of all of the above, I've got to be honest with you. So the total number of calls that really signify that people are either developing symptoms consistent with COVID, the percent positive tests, which right now for us is above 10%. For me, what that means is that we're seeing not only increased volumes of tests coming back positive, but it also means we have ongoing increased transmission. So just let me be clear. It is clearly increasing in terms of the amount of spread in our communities. So the only way to get a handle on this is to reduce that. People got to wear their masks. People got to wash their hands. They've got to reduce, unnecessary contact in the community. They've got to follow the public health orders. That's the only way we're going to get a handle on this, because the hospitalizations are sort of an end result from my standpoint. So the fact that we're still seeing increases in hospitalization tells me that we're in for continued increases over the next 2 to 3 weeks.
So, you know, personal responsibility, wearing masks, all the things you talked about just now are very important. But what about the federal leadership? We've heard from a variety of medical experts talking about the lack of leadership at that level. What would you like to see? Is it more concrete help or more symbolic efforts like, the president wearing a mask? Would that help?
I think that at a fundamental level, modeling the behavior that we want people to do is critically important. Seeing our top public officials endorsing that, really using that bully pulpit is key to leading the way. The second thing is concrete action, getting help like the mayors are asking for that I've heard over the last couple of days when it comes to supplies, appropriate staffing, transfers of patients. That requires a level of coordination where the federal and state authorities need to be working together. That is going to be critically important. When I've looked at other countries and how they've been able to get a handle on this, that is exactly how it happens, and coordinating with the healthcare system.
All right, well, let's hope some of that happens. Dr. Stephen Parodi, thank you very much for your insights here.
Thank you for having me.